All right, we're going to talk about something that is incredibly important, especially if you spend any time in the sun. We're diving into skin cancer. We'll break down what it is, what to look for, and what happens next. So let's get right into it. I want to start with a number that, honestly, it really puts everything into perspective. 2 in 3. Just let that sink in for a second.
That's right. 2 out of every 3 Australians will get some form of skin cancer before they turn 70. It's one of the highest rates in the world. Now, the point here isn't to scare you, it's to arm you with the knowledge you need to protect yourself.
So, what exactly is skin cancer? Well, first off, it's not just one single thing. There are actually a few different types. And to really get it, we need to look at where they start, which is deep within the layers of our skin. Okay, so take a look here. This shows us exactly where the trouble begins. It's in the epidermis, that top layer of your skin. Now, the specific type of cell that goes rogue determines what kind of skin cancer it becomes. You've got your melanocytes, those are the cells that make pigment, and you've got your keratinocytes, which basically build the structure of your skin. And that difference is key to everything else we're going to talk about. And that simple difference brings us to the 2 big families of skin cancer. You've got melanoma on one side, and then everything else, which we call non-melanoma cancers, or NMSC for short. These are the 2 fundamental categories we need to understand. Let's break that down a little more. Melanoma, that starts in the pigment-making melanocytes. It's actually less common, but, and this is the important part, it has a much higher risk of spreading if you don't catch it early. Now, NMSC, that comes from the keratinocytes. The 2 you hear about most are basal cell and squamous cell carcinomas. They're way more common, but generally less dangerous. So the bottom line is, the cell where it starts pretty much dictates how the cancer is going to behave. Okay, so that's the science bit. But what does this stuff actually look like on your skin? This next part is all about the practical side of things, how you can become your own detective. Take a look at this. This is a classic example of what more than half of all melanomas look like. It's called a superficial spreading melanoma. It might pop up as a brand new spot, or it could be an old mole that suddenly starts changing. You see how it has that irregular shape and the different shades of color? Those are total classic warning signs. And that brings us to this super helpful tool that doctors use for checking spots, the ABCD guide. A is for asymmetry, meaning one half doesn't look like the other. B is for border. Is it uneven or jagged? C is for color. Is it blotchy with different shades of brown, black, or even red? D is for diameter. Is it bigger than about 6 millimeters? And maybe the most important one, E is for evolving. Has it changed at all? Any change in size, shape, or color is a red flag. But, and this is really important, not all melanomas follow those ABCDE rules. There's another, more aggressive type out there called nodular melanoma, and you need to be on the lookout for it in a different way.
A nodular melanoma usually looks something like this. See how it's a raised lump? It's often firm, and it grows fast. It could be dark, but it could also be skin-colored or pink. The real danger here isn't that it spreads out wide. It's that it grows down, deep, into the skin, really quickly.
So for this one, you need a different acronym, EFG. E for elevated. Is the spot raised? F for firm. Does it feel solid to the touch? And G for growing. Has it been getting bigger for more than a month? If you see something that ticks these boxes, you need to get it checked out, and fast. So what about those other non-melanoma cancers? Well, on the left here, you can see a basal cell carcinoma, or BCC. This is the most common type of all skin cancers, period. It often looks like a shiny, pearly bump. The good news is it's the least dangerous. Then on the right, you have a squamous cell carcinoma, or SCC. This tends to look more like a scaly red patch. It's a bit more serious than a BCC because it can spread if you leave it alone. So let's say you do find a spot that's worrying you. What actually happens when you go to the doctor? Well, the good news is there's a very clear and structured process they follow. It all starts with that initial checkup. Your doctor will probably use a special magnifying tool called a dermoscope to get a really good look at the spot. If they're still suspicious, the next step is a biopsy, which just means they'll remove the lesion so it can be tested in a lab. From there, the results of that biopsy tell them the stage of the cancer, and that's what determines the treatment plan. Now, for melanoma, there is one measurement that is absolutely everything. It's called the Breslow thickness. It's literally just a measurement of how deep the tumor has grown into the skin. And why does that matter so much? Because the deeper it goes, the more likely it is to have reached blood vessels or lymph channels, which is how cancer spreads. This single number dictates the prognosis and the entire treatment plan.
Okay, and this is where the story gets really, really hopeful. For melanomas that have already spread, treatments have been completely revolutionized. We now have targeted therapies that go after the cancer's specific genetic weaknesses, and immunotherapies that basically unleash your own immune system to fight the cancer. Thanks to these breakthroughs, the 1-year survival rate for advanced melanoma has skyrocketed from around 30% to over 70%. I mean, that's just a massive leap forward.
As amazing as modern medicine is, the best possible outcome is to just not get skin cancer in the first place, right? And the power to do that is largely in your hands. So the big question is, what can you actually do? Well, your role here is really twofold. It's about prevention and it's about early detection. First up, prevention. It's no surprise that unprotected UV radiation from the sun is the #1 risk factor. That means both UVA rays, which cause aging, and UVB rays, which cause burning. So using sunscreen, wearing protective clothes, and just staying out of that intense midday sun, those are your best weapons. Preventing the damage before it even starts is the most powerful thing you can do. And the second piece of the puzzle is early detection. This is where you have to be your own advocate. Get this, an incredible 50% of melanomas are first found not by a doctor, but by the patient themselves, or even a family member. Just knowing your skin, knowing what your moles look like, and checking yourself regularly. It's a simple habit that genuinely saves lives.
So if you take one thing away from all this, let it be this. Get to know your own skin. Check it. If you see anything new, anything that's changing, or just anything that seems a bit weird for you, go get it checked out. Because when it comes to skin cancer, the difference between a minor issue and a major health battle is often simply time.